Morning. Good morning. We're glad to be here today to highlight a partnership to increase vaccination rates in some of our most disproportionately impacted communities. Before I get to that, I want to give an update on some state COVID data. Yesterday, the Department of Public Health reported 1,400 new cases on about 58,000 tests. We're right around 20 million tests at this point that have been reported. 714 individuals are in the hospital and 165 are in the ICU. With respect to vaccines, over 4.6 million total doses have been administered in Massachusetts, including 2.8 million first doses and 192,920 doses of J&J. We're on track to fully vaccinate 2 million residents here in the Commonwealth this week, which would be about halfway to our goal for vaccinating eligible individuals in Massachusetts. We're hopeful that we will far exceed that goal and get as many people vaccinated as possible. We continue to be a national leader with respect to getting our residents vaccinated. We have been and continue to be the top state among the 24 states with over 5 million people in administering both first and total doses per capita, and we remain a top 5 state among all states in administering first doses. 85% of our residents aged 75 and older have received at least one dose of the vaccine, and over 83% of residents 65 and older have received at least one dose of the vaccine, which is ahead of the national average of about 75%. And 80% of the people over the age of 60, that would include me, have received at least one dose. Before I get into more detail on the allocations for this week, I do want to talk a bit about the pause on J&J. Yesterday morning, the CDC and the FDA recommended an immediate pause for the administration of J&J doses nationwide, and Massachusetts, like other states, complied with this request out of an abundance of caution and are awaiting more information from federal medical experts. According to the FDA and the CDC, out of nearly 7 million doses of J&J administered to date in the U.S., 6 cases of an extremely rare but serious medical condition have been reported. This equates to less than 1 per 1 million. None of these cases occurred in Massachusetts. Federal medical experts are leading the investigation into these cases, and today the CDC has convened a meeting of experts to further investigate these cases, and the FDA will review that analysis, and we obviously eagerly await further guidance with respect to next steps. According to federal officials, more information is expected to be available within days to help states manage vaccine distribution, and in the meantime, J&J shots will remain paused here in the Commonwealth. The health and safety of our residents remains a paramount and fundamental concern for us, and the Commonwealth will closely monitor this issue and follow federal guidance as we continue to move forward with our vaccination program. The J&J supply in Massachusetts is currently a small portion of our supply, and in the immediate future we're expecting minimal disruptions to schedule new appointments. For example, this week the Commonwealth received 11,600 doses of J&J as part of our state allocation. We're receiving 340,000 doses of Moderna and Pfizer as part of that same state allocation. J&J therefore accounted for about 3% of this week's doses. If you currently have an appointment scheduled to receive a J&J vaccine and have questions about your appointment, you should reach out to your provider or the vaccination clinic where you have that appointment scheduled. According to the CDC and the FDA, severe symptoms, not mild flu-like symptoms, have been reported within 2 weeks of the J&J vaccines for these rare individual cases, and they involve things like severe abdominal pain. If you've received the vaccine recently and experience unusual symptoms, severe pain in the abdomen, severe headaches, severe leg pains, you should definitely reach out to your clinician. Now, with respect to this week's allocation, it includes 353,660 first and second doses. It's 208,260 first and second doses of Pfizer, 133,800 first and second doses of Moderna, and as I said before, 11,600 doses of J&J, which will be paused. For next week, the federal government's notified us that we'll receive a modest increase in Pfizer and Moderna doses next week, something around 8%. In addition, this week the federal government's directly allocated 272,360 doses to community health centers, the federal retail pharmacy program, and their community vaccination sites. The community vaccination sites, which are part of the FEMA program, which supports the Hynes operation here, and some mobile vaccination clinics will continue to receive 42,000 doses per week directly from the federal government. Through the direct federal allocations, the federal retail pharmacy program will receive about 130,000 doses, and another 8,000 doses are being sent to pharmacies from this state allocation. Community health centers are receiving 79,250 doses between the state allocation and the direct allocation that they're getting from the federal government. Now, with respect to today's announcement, as everybody knows, April 19th is right around the corner, and at that point in time, all individuals over the age of 16 will be eligible for a vaccine here in Massachusetts. This is a significant milestone in our mission to vaccinate eligible residents and bring this pandemic to a close. As a critical part of our vaccine administration program, we've launched targeted outreach efforts in the communities that have been most disproportionately impacted by COVID to raise awareness and increase access to vaccination opportunities. We've been working closely with trusted local partners and community-based organizations to reach residents in these communities, and today, to boost this effort, we're pleased to announce a Red Sox Week at the Hynes. It's a week-long initiative here at the Hynes Veterans Convention Center designed to increase vaccine access for populations that are disproportionately affected by COVID-19. The initiative will be running in partnership with the Red Sox, the Base, El Mundo, and CIC Health. And it, of course, would not be possible without the support and the increased doses the site gets from FEMA each and every day. Between April 19th and the 25th, up to 20,000 first dose appointments will be reserved for residents from disproportionately impacted communities. Appointments are being scheduled through grassroots outreach efforts by community partners that are standing here with us today. They include the Red Sox Foundation, El Mundo, the Base, Baker-Polito Strategies Group, Healthcare for All, and the Boston Public Health Commission. For the week of April 19th, any unfilled appointments will be booked through the Commonwealth's pre-registration system. All of these organizations have strong presence in the state's 20 disproportionately impacted communities and are working hard to get more people and households out to get their shots. And have even tried to have a little fun with this one with the Red Sox while doing so. Red Sox Week at the Hynes will include bilingual Spanish-speaking staff and volunteers, Spanish signage to help direct guests through the on-site registration and vaccination process, and Red Sox-themed attractions, including a selfie station, Red Sox trophies, socially distanced visits with Wally, the Green Monster, and a raffle to win tickets to a Red Sox game. We understand the vaccination process can sometimes be stressful for some individuals, especially those who come from communities that have been hit hard by the virus. Our goal is to encourage more people to come to Boston with family and neighbors to get vaccinated together and to also create an experience in Spanish from beginning to end. Residents who have their second doses scheduled for the Hynes will have their appointments honored, and you may have the extra bonus of getting a glimpse of Wally the Green Monster while you're here. The extra bonus. You got that, Jonathan? Okay. Beginning Monday, all individuals in the Commonwealth 16 and older will become eligible for the vaccine. That's an additional 1.7 million people. While our supply from the federal government has seen a modest increase, as I've said before, our capacity to administer doses remains much greater than the number of doses we get each week. For people who become newly eligible on Monday, you should expect it may take several weeks to book an appointment, and information for all vaccine sites are available at mass.gov/COVID vaccine. If you're seeking an appointment at a mass vaccination site, pre-register for an appointment at mass.gov/COVID vaccine. Our tech team continues to work hard to improve our website and user experience and is prepared for the influx of traffic that will probably occur before and on the 19th. This week, 4 new regional collaboratives will be added to our pre-registration system: Northborough, West Springfield, Palmer, and Northampton. That makes a total of 6 regional collaboratives now on the VaxFinder to increase visibility for users. If you're looking for an appointment at one of these regional sites, please pre-register. And even if you pre-register, you can obviously continue to look for an appointment at other providers like pharmacies, community health centers, and your healthcare provider. In fact, I would say at this point we've had, about 300,000 people who pre-registered and then unregistered because they got an appointment somewhere else? Yeah. Is that about right? Okay. We're working to get doses to eligible people as fast as we can, but how fast we move will continue to depend on how fast we get doses from our friends in Washington. The vaccine saves lives, and it's our way out of this pandemic. And I can't emphasize enough how much real-life data we now have that demonstrates that folks who get vaccinated in large numbers present much fewer cases and much fewer hospitalizations than they were just a few months ago. The best example of all of this is the senior population, whose number of case counts and whose hospitalizations have literally dropped like a rock since they started getting vaccinated back at the end of December. Millions of people across the country have been vaccinated, and I got my first shot in this building about 10 days ago, and will be back for my second one around the end of the month. And it's critically important, I believe, for me and for my family that I get vaccinated. And I think it's critically important for everybody when they have that opportunity to sign up and get vaccinated. And if you have questions about the vaccine, you can always talk to your healthcare provider or to other trusted experts in your community. The vaccine's a big part about getting back to what we might call normal, and it's critical for all of us to take advantage of this opportunity when we have it. Doesn't mean we should let down our guard. Everybody still needs to pay attention to the rules associated with masks and distance and hygiene, and the rules and guidance that we have in place for employers will continue to be an important part of how we deal with variants and the vaccine that and the COVID consequences that remain here in the Commonwealth as we work our way through this vaccine protocol. But as I said before, when you're eligible, please sign up and get vaccinated. It's the best thing you can do for you, your friends, your family, your coworkers, and your neighbors. And with that, I'm going to turn it over to Sam Kennedy.
Thank you very much, Governor Baker. It's an honor and a privilege to be here again with everyone, and thanks for the opportunity to have Red Sox Week at the Hynes. Just awesome, and we're proud to be a part of it. I want to thank Governor Baker and Lieutenant Governor Polito and Secretary Sutters for their continued leadership, getting all of us through what has been an incredibly difficult period. As a citizen, we say thank you, but also as a public trust and a business operator in the neighborhood here, just a few blocks away at Fenway Park. I can't tell you how much we have appreciated the constant communication, information flow, and the partnership between the state government and the Red Sox and everyone across the state in entertainment and the sports business. We're very grateful. And we've seen a lot of great things in 109 years, roughly, at Fenway Park. World Series championships, great political speeches. We've seen recovery efforts like we saw after the 2013 Boston Marathon bombings, but nothing was more important or more emotional than having the privilege of serving as a vaccination site in February and March. So thank you for that opportunity as well. Thanks to my colleagues who made it happen, some of whom are here today. Jonathan Galula, our Chief Operating Officer, Dave Friedman, Zineb Curran, thank you guys for being here. And Pam Ken gets a special shout out for organizing everything that's going to happen for Red Sox Week at the Hynes. The last thing I'll say is to the gentleman who will speak after me, and Governor, thank you again for not having me follow Robert Lewis. I appreciate the speaking order today. No one ever wants to follow Robert Lewis. We've been in this incredible position to work in the front office as a team for 20 years together. John Henry and Tom Werner established a few fundamental commitments back 20 years ago when we got here. Of course, we wanted to win World Series. Of course, we wanted to preserve and protect and enhance Fenway Park, but we really wanted to be connected in a deep and meaningful way to the Boston community and to the New England community. And thanks to my dad, 20 years ago, I was introduced to Alberto Vasallo, my brother, and we have been partners and friends for 2 decades. And it is safe to say that no one has done more to connect the Red Sox to the community than Alberto and El Mundo. So, Alberto, thank you for that. And thanks to Charlie Baker, I was introduced about 6 or 7 years ago to Robert Lewis from the base. It has, in those 7 years, become perhaps our most important partnership in terms of growing the game of baseball in the city of Boston. Robert and his organization are the model across the United States for giving kids the opportunity to play the game that we all love, and we are so proud to be their partners and support everything they do. And there's been a lot of low moments over the last year, but the highest, most positive moment for me came July 23rd, when the governor and the former mayor of the city of Boston hosted Robert Lewis at Fenway Park to throw out that first pitch to kick off the 2020 season, which was a forgettable season. We acknowledge that. But seeing Robert throw that ball to Jackie Bradley Jr. in center field was particularly emotional, especially after the incredible battle against COVID-19 that he endured and showed what Bostonians are about, the resilience and toughness to come back from that. So it's a privilege to turn it over to my friend and partner, Robert Lewis of the base. And thanks again for having me today.
Wow, I was thinking, Sam, what a great introduction, right? And in hearing that folks are going to have access to Wally and the tickets and everything. I'm excited to be here for a few reasons. One, I want to just start off and I want to just thank Governor Baker. I want to thank Lieutenant Governor Polito and thank Secretary Sutters. And to be standing here with Sam and Alberto and folks I've known for such a long time. It's a moment that is so important. The governor was saying about saving lives. I remember it was a year ago, what a difference a year makes, that I was fighting for my life when I was on a ventilator for 12 days, and because of this thing of COVID-19. And to see that impact that, COVID had on our communities. And for us to be here today, for me to be here, and for the base to be here representing our community, our young folks, our alumni, our families, our staff, our coaches, and our partners. We're excited to be here as part of the Red Sox Vaccination Week here at the Hynes. Our young folks, families, alumni, coaches, and staff deserve access, to the vaccine. And the opportunity that we, as a locally based, community-based organization that is using sports as a vehicle that connects us with teams in Lawrence, teams in Malden, in Lowell, in Lynn, in Brockton that participate in our programs, that we can reach out and let them know that not only these young folks who are ball players, but their families and their colleagues could be part of this vaccination week. This is very important, and it shows the power when government, sports, institutions, academia, and community comes together, we can do big things. So we're excited. You know, my colleague Laurie DePina, who's here, who's my site director, we've been out, folks are registering, that we're able to, when parents are coming in or waiting outside of our office, that we're out there talking with them and letting them know, and yes, some folks have some concerns. But what I love is that they trust their coaches, they trust the base, and they trust their partners for this. So we're very excited, and we're actually humbled, and we're just looking forward to spreading the news, spreading the message, letting folks know how important this is. If we're going to get back to a feeling of safety and a feeling of normal, we want to make sure folks get vaccinated. I can tell you, when I got my second shot 5 weeks ago, I can't tell you how excited, how emotionally excited I really was. But it was also great psychologically, but knowing if I can get this, I want to make sure that others throughout our community can as well. So again, I want to just thank the governor, Lieutenant Governor, Secretary, Sam in the Boston Red Sox, FEMA, and also all the work, Alberto, that you continue to do to get the message out there. Our Black and Latino communities need to know that they have access, and it's our fundamental responsibility to make sure that we're providing them that information. So thank you, and we look forward to being here all of next week and celebrating Red Sox Vaccination Week here at the Hynes. Now I'll turn it over to my good friend, Alberto Fasaglio from El Mundo.
So I don't mind going forth because I was told it was done by ascending order of age, so. What Sam didn't tell you is we did meet 20 years ago. He was in high school, I was in grammar school, so. But I do want to thank the governor, Sam, LG, I like that term, Polito, Secretary Sutters, and of course my friend Robert Lewis, who, if many of you recall, we were all praying for him about a year ago. He was probably one of the first cases that I knew about COVID-19, and after his 12 days being under, we all knew that this was very, very serious. So I'm so happy that you're here and healthy as ever. Today, I am here not as a member of the media, but as a member of a community that's been hit extremely hard by COVID-19. And I'm actually asking for help. I'm asking for help in convincing, persuading, and championing that very important slogan that the governor stole from me, called La Vacuna Salva Vidas, the campaign, the vaccine saves lives. And while this may be a very super obvious concept to many of you and many of your audience, in my community, there is still far too many concerns, doubts, and apprehensions about getting vaccinated. And now, we obviously enter a very important phase for our Commonwealth. Come Monday, when the biggest swath of people become eligible, our younger population, we will also face our biggest challenge, because Latinos in the state of Massachusetts is one of the youngest demographic groups we have. The median age for non-Latinos in our Commonwealth is about 43. The median age in the Latino community is 26. And they are not lining up as fast as we would like them to get vaccinated. So I want to thank the partners here today for taking this initiative of leveraging a brand that we all love, especially in the Latino community, the Red Sox, and putting many, many resources together. We've been having daily meetings with about 20 folks that involve Red Sox personnel, it involves Department of Public Health, it involves folks from the governor's office, it involves other community folks who have a vested interest. So it is the beginning next week of a fun journey, but also one that is still very, very challenging. So before ending, I just want to say a few words in Spanish for, I see Telemundo, Univision, and Jonathan Hall, who always needs to practice his Spanish. So, yes, we worked together at Channel 7 for many years. So, amigos, estoy aquí porque hoy con nuestro gobernador, a nuestra vicegobernadora, a nuestros amigos de los Medias Rojas y CIC Health. La próxima semana iniciamos la semana con los Red Sox aquí en el Hynes para comenzar la mayor cantidad de personas para ser vacunadas. Comenzando el lunes todos somos elegibles para la vacuna y acá lo vamos a esperar con Wally y mi equipo, los Medias Rojas. Así que recuerden, la vacuna salva vidas, ayúdenos a correr la voz. Muchas gracias. Thank you.
Questions on this?
Governor, could I ask you first about the Johnson & Johnson issue? First, we had the batch that was spoiled, and now we got an issue with side effects similar to the AstraZeneca. How concerned are you about planning for the future, given the unpredictability of supply, but now also maybe no supply for a while?
So first of all, we've been blessed to have what I've described as a pretty consistent rollout for the better part of the past 6 weeks from Pfizer and Moderna. And there's going to be another increase, modest, but it's on a much bigger base than it used to be on next week of both of them. We think the best thing for us to do at this point in time is follow the federal guidance, wait and see what comes from their review with respect to those 6 cases and any decisions they believe we or others should be making going forward. Do the best we can to make sure we reschedule appointments for people that were scheduled for J&J and continue to pursue the program that we've got in place. We're basically on track with where we thought we were going to be back in December, despite some of the bumps along the way. And as I said, the J&J and the issues associated with that, the feds need to buckle down on and decide how they believe we should move forward. But in the meantime, we have very significant Pfizer and Moderna supplies, and we expect that to continue.
So you're thinking it's just a minor glitch, or just a road bump, and we'll be back on track with J&J within a week?
I don't know the answer to that because it's going to depend completely on what the feds decide based on their review of those cases. My point is that it's a relatively small part of our distribution to date, and we do have and expect that we'll continue to see modest growth in the Pfizer and Moderna supply going forward. And we've been able, as I said, to continue to maintain an administration rate and a vaccination rate that was pretty consistent with what we thought we were going to be able to do back in December, even with some of the issues around supply.
Governor, you talked a lot about Johnson & Johnson, how it was going to be a better solution because of the one shot. And I think Hynes was going to convert to all J&J too as part of the FEMA program. What are you guys doing just to try to re-engineer the distribution on the back end? That you heavily rely on J&J.
Well, obviously, we're going to wait and see what the guidance we get from the feds looks like, but the goal here would be to continue to do the outreach activities that we've been doing, and we'll just focus those for the time being using Pfizer and Moderna supplies.
Some people were also complaining that they didn't get a lot of information yesterday. They were, finally getting their shot. We've heard from the command center, of course, but the governor didn't come out. This was a major blow to the distribution project, nationally and in the state.
Well, remember, most of the doses that we administer here in the Commonwealth, the vast majority of the doses we administer are Pfizer and Moderna doses. And I've always thought of the J&J as sort of the accelerant to where we already are. But at this point in time, we're going to wait and see what the feds got, what federal guidance looks like on this after they complete their investigation. But we still have a fairly significant base that we're building on. We have a ton more capacity, and we've talked about that before. And if the supply is there, with or without J&J, we're going to have no trouble making sure that we administer it.
Does this J&J news make it an even harder sell to convince people who are reluctant in the first place to come forward and get a vaccination? Are they seeing this news and going, hey, maybe this isn't for me?
I think the most important thing I can say about vaccinations generally is the impact it's had on some of the most vulnerable communities in Massachusetts and across the country and frankly around the world is pretty clear at this point. The vaccines work. If you look at the population, if you look at the hospitalization rates and the case rates among those groups of people who've been vaccinated, they've evaporated, and in many cases involve some of the folks that we were most concerned about. I think the vaccines remain safe and effective, and I would argue that in some respects the decision that the FDA and the CDC made here based on 6 cases out of 7 million administered to put a pause on this and take a look at it is an example of the system working the way it should. You know, in an abundance of caution, they put out the word and said, we need to take a look at this, and that's what they're doing. And I think, I got asked the same question about Baltimore, and I said Baltimore to me was the same thing, which is pretty clear these guys, you know, saw there was an issue, stopped it, ran the investigation. That's what you want the process to be. There should be a self-correcting mechanism in there.
Governor, how will this affect? J&J has been used for like mobile vaccination clinics and kind of targeted population. What will the state be doing, you know, will that switch to Pfizer? I know that's kind of a little bit more logistically challenging.
I think we're going to, we'll use whatever vaccine is available. The rules and the logistics will be different, but we've demonstrated over the course of the past several months that we can work with whichever product is available to us, and we'll continue to do that. And our goal is to continue to build on the success we've had so far, and with programs like this to make sure we have a process and a set of partners who can help us make sure that we get to folks in those most disproportionately impacted communities and get them vaccinated as well.
Governor, on the R&D issue, when do you think this is going to be resolved, and how concerned are you that there might be some vehicles that are unsafe that are on the road?
Well, we're talking now about 2 or 3 weeks of incredible inconvenience for everybody. I think it's our expectation that by this weekend this issue will be resolved. I would love everybody to be able to get their sticker when they're supposed to. And I think the most important thing I can say about this is that we are going to we've talked to our colleagues in law enforcement, we've talked to a lot of folks at the registry, we're going to make sure that people have the opportunity and the window to actually get their car inspected when they need to.
Do you think there might be some cars, though, that shouldn't be on the road?
If this thing was dragging on for a really long time, I'd start to worry about that, but if it's a 2 or 3 week issue, it's a tremendous inconvenience, but I don't think of it as a public safety issue.
Governor, on Red Sox Week, how effective do you think it's going to be to try to connect with some of these groups?
Well, I certainly think we have trusted partners here who know these communities well and are respected and trusted by them. I don't know if either Alberto or Robert want to speak specifically to that.
Just talking about how it will be so effective, like the whole process of doing a Red Sox Week, a focus on certain communities.
Well, there are challenges. One of them that we addressed, like in light speed, was putting a phone number that tomorrow will have our community, my particular community, does not respond as well to email links and so forth. We know that. So tomorrow there'll be a phone number that will be distributed through all media channels, not just Telemundo. We're asking all our colleagues in the media like Telemundo to help us with that. So there are definitely challenges that we're obviously addressing. But I think that, you know, we have folks like Pedro Martinez, Big Papi, who folks in our community at least catch their attention. We're going to be using those as a focus point. And more importantly is our community tends to wait till the last minute. So I believe that on Monday and Tuesday, when there's a buzz, when hopefully some of you guys show up, and I'm asking you guys to show up and kind of show this fun atmosphere, it helps move the needle. But it is a challenge because it's one of the communities that that has the most hesitance, and we're trying to kind of create a fun environment, a fun message that's very important.
Sam Kennedy, can I ask you a question?
Yes, sir.
Sam,
Right at the
you need to-
podium. Yes, sir. Since
I
we
guess
have,
it depends on what the question is.
Well, I mean, you've got the governor here right with you. Would you like to see increased capacity at Fenway since it's outside? More people are having vaccines, and do you think it would be a safe environment if you want to make a pitch?
Yeah, that's the easiest question I'll get all day. Of course, the answer is yes, but we'll do it at a time when the health officials and our government officials tell us it's the right time. We you know, the special thing about Fenway Park is the energy from the fans. And we're all dying to get back to some sense of normalcy, but we can only do that at the appropriate time. And that is, hopefully we're good at operating a baseball team and a sports venue, but we are not doctors, and so we'll leave that to the experts. And hopefully that'll happen sooner rather than later. We're really excited to welcome our fans back when it's appropriate to do so.
And could I ask you quickly, are there any players that you think might be able to step up to help with this effort to reach out to the Latino community?
Great question. Yeah, I was talking to Alex Cora actually on the way over here, and in addition to asking him to please win 2 more today in Minneapolis, he actually said, do me a favor, tell the Gov. So I'm going to tell the Gov. Alex said, whatever he needs to do to help spread the word in the community about the importance of vaccination, he's all in. So we can count on our leader, Alex Cora, to do that. And many of our players are going to get vaccinated, and we're looking forward to that as well. And that I think sets a good example for everyone else.
What would that look like? Would that be a public service announcement? How can you reach out?
Yeah, public service announcement. We have a great following on social media, so creating messages from our players. Alberto mentioned Pedro Martinez and David Ortiz, who have already engaged in PSAs and using our television network Nesson, our radio following, just to spread the word about the importance of getting vaccinated. As the governor said, it is the key to getting out of this situation. So we encourage all of our fans all across New England and all across the world to get vaccinated. Thank you.
Talk about how this will affect the homebound program that you had just launched, other programs that were built on the J&J one-dose vaccine being easily transportable. Will you have to pause the homebound program as well?
The short answer to that is no. Do you want to speak to this one, Mary Lou?
I forgot to wear my red, white, and blue today. Sorry about that, Sam. Obviously, we're waiting for the guidance that comes out from the CDC and FDA, and they're meeting today, and that will sort of guide our decisions, but we are quite capable of taking the homebound program and converting it into a 2-dose program. So if that's what we need to do, it's not to stop the homebound program at all. We'll convert it into a 2-dose program. Makes it a little bit more logistically challenging, but we can certainly do that. And several of our mobile programs at this point use Moderna. So, it's a bump, and we're looking forward to getting the guidance from the FDA and the CDC, and we'll pivot accordingly.
Last question. Governor, how long will it be before everybody has registered will actually get this? How long do you think?
The hard part about answering the question about pre-registration is people do. I mean, pre-registration, we've discovered for a lot of people, is what I would call the safety valve, right? They pre-register and they wait to hear back from the pre-registration system, but they continue to chase appointments. And as I said, out of the 1.5 million people plus or minus who've pre-registered, we've had about 300,000 people who unregistered, which says to us that they went and got an appointment somewhere else. So it's a hard question to answer when you say, how long would it take somebody? What I can say is, generally speaking, and this is based on nothing more than what I would describe as sort of big numbers looked at and analyzed and processed, and then some, estimates. It's about 2 or 3 weeks from the time you pre-register, although it depends a little bit on where you live and whether or not you choose to stay on the site or take the first opportunity you have to book an appointment. There's also a bunch of people who don't take the first opportunity and come back and take the second one.
Governor, you were saying that you were hoping to have a significant number of people vaccinated by Memorial Day. Is that still an achievable goal? It was obviously more than there are now. Would you be at the level that you hoped you would have been when you made that statement?
Some of that will depend a little bit on the Pfizer and Moderna supply, right? Pfizer said yesterday they're going to up their production. Moderna sort of implied they would do the same thing. But I do think we will be able to have a significant, if you think about it, there's already a ton of people who are in the process who've been first dosed and are going to get second dosed, and a ton of people who are going to get first dosed who will then at some point in May get second dosed. I think, hundreds of thousands of people, maybe millions. It's 31 days in May, and we got another 15 days in April. I think we can get to the point where very significant, yeah, right. And we'll have 2 million people done probably by Saturday. I think by the time you get to Memorial Day, a ton of people in Massachusetts will have been vaccinated, yeah. I do want to...
So the people who were already scheduled,
lot of them got Moderna or Pfizer instead. So those are doses that, so there's going to be a backlog, right? I mean, there has to be logistically.
Remember, you're talking really small numbers, relatively speaking. We got very small, we had 11,600 doses of J&J for the week we're in now, and we got 380,000 doses of Pfizer and Moderna. So there's definitely some logistical issues there. But the truth of the matter is, the bulk of our vaccination program from the beginning has been Pfizer and Moderna.
Governor, can we get
But
your,
it's
can we get your gut
different. You just said
reaction?
it's like 2-3 weeks, did you just say, that for pre-registration that you normally
Yeah.
have to wait? Does that change, how does that change if nothing changes with the CDC?
I don't think, because there's not that much J&J that's currently in the pipeline, I don't think it changes that much. I always thought of it more as a significant way to dramatically increase the delivery of the capacity we already have. I mean, remember, I've said this many times, we have probably a 2 times or a 3 times daily capacity to vaccinate than we actually get supply. And in my mind, I always thought of the J&J as a piece that would be a significant part of sort of amping it to the next level. If it's there and the feds tell us that they believe that it's safe, that's one thing. But if they don't, like I said, this is a program that's built primarily on the back of the Pfizer and Moderna vaccines.
Governor, can I follow up on the Fenway Park capacity issue?
I'm so surprised that you want to follow up on that, Jonathan.
What do you think about maybe increasing capacity at an outside venue versus, say, the Garden?
It's a long season. We have tried since the beginning of this to be respectful of 2 competing concerns. One is the public health and safety of the people of the Commonwealth, and the second is the mental health and psychological health and economic health of the people of the Commonwealth. And those 2 things are the way we practice almost every decision we make about trying to balance those. Because anybody who says there's not a downside or an upside in either of those areas when we make decisions is just not paying attention. And we currently are dealing with some very significant variants. It's not news. Many of you have reported on it. And those variants are far more contagious and in some cases potentially more dangerous than what we have seen so far. And it's part of the reason why the vaccination program is so important. And what we've said many times is we want to see how this plays out over the course of several weeks, maybe a month, to see where we are before we make decisions about moving forward.
Can we just get your gut reaction when you heard the pause? I know you've done the math, and it seems like we're in better shape than we thought, but what was your gut reaction yesterday when you heard about the pause?
Well, my gut reaction was the CDC and the FDA are calling for a pause because they saw in a very small number of cases something they couldn't explain. And therefore, they were going to get a bunch of people together and take a look at these cases and figure out what the most appropriate response to that would be. So my first reaction was, I'm glad they're taking a look at this based on the available data. But of course, as somebody who wants to see people get vaccinated, I mean, Mary Lou got the J&J. I would take the J&J if it had been available, and I'd still take it. But I think it's important for the feds to do their homework on this, because the last thing we want to do is make decisions based on anything less than the best available information. And I expect at some point in the not-too-distant future, we'll hear back from the feds, and they'll tell us what they think the most appropriate thing to do and the safest thing to do is going forward. And we'll abide by that decision.
Why does the J&J vaccine be reaching out to patients to ask them if they have symptoms? Do you even have contact information to do that anymore?
What we've said is that The CDC and the FDA's guidance on this one was pretty clear, which was the typical reaction that people have to a vaccination, which is, what I would describe as sort of flu-like symptoms within a day or two or three of getting vaccinated, is not what they believe the symptoms associated with this look like. They said the symptoms on this are 6 to 13 days out and are typically severe leg aches, stomach aches, headaches. And they said if you experience that sort of thing, you should reach out to your provider, period. And I think that guidance is pretty clear for people. If you got a J&J and you got it, a month ago, you're pretty much outside the window of what the feds believe you should be considering. But if you're somebody who's sort of inside the window, you should look for those kinds of symptoms. If you see them, you should definitely reach out to your clinician.
Thanks, everyone. Did the communication go in the other direction from the provider to the people in that window?
I think the hard part, I can't speak for all providers. Some may, in fact, go ahead and do that. I think the bigger challenge there is trying to figure out how you would actually process that kind of information. Telling folks what they need to be concerned about, and then saying, if you have any of these in this time frame, reach out, I think is a far more effective way of making sure that people who actually do have concerns get in front of a doctor and get in front of a doctor at the appropriate time.
Thank you.
Governor, can I ask a non-vaccine question? Have you read your administration led that tax expenditure they should report? Have you read it? Have you thought about it? Are you going to take some action?
Are you talking about the one that was done by the Senate?
Yeah, but your DOR, I think, was the chair of the commission. Anyway, yes. I think
This is Adam Hynes' report. We were staff to that. I don't think we didn't share that, did we? No, we didn't share that.
the head of the DOR was very active in.
Well, I'm sure that, I'm sure they would have been involved, yeah.
But my question is, you talk about a lot of tax breaks that should be looked at and reviewed. Is your administration interested in doing that?
I have not read the report. I've been kind of focused on what we've been talking about today. But we'll certainly take a look at it at some point, yeah.
Thanks, everyone.
And thank you guys for stepping up, and thanks to FEMA for their help on this as well.